You know, at some point in our lives, we're all going to visit a urologist for some reason or the other. And the older that we get, the more of a probability of that happening is. Well, today we're at South Mississippi Urology over in Ocean Springs, talking to Drs. Mark Lyle and talk to Dr. David Spencer, who are urologists here. Thank you for being on the show. Dr. Lyle, let's talk to you first, if we could, please. Tell us first of all a little bit about yourself.
Well, I've been practicing on the Gulf Coast for about 22 years. This is where I came right out of residency. I've enjoyed taking care of folks here for a long time.
Well, there's a lot of things that has to go along with urology problems, and we're going to kind of divide it up between the two of you. But let's talk to you first about it. One of the things is, and I guess more as I mentioned, we have more. The older that we get, more things to be aware of. Prostate cancer. I mean,
Yes.
speaking as a male, that you know, a lot of things that men should probably get checked for on a regular basis.
Prostate cancer is certainly very important for men. We recommend that anyone who has a family history or any risk factors for prostate cancer start being checked at age 40 for that.
Mm-hmm. Now, one of the great things too, and we've seen before, is whenever it comes to having to do some prostate surgery, you've got a great little laser system called the Da Vinci.
Well, yes, it's really a revolutionary device that we've been using for 6 years. We were the first ones to actually have the device on the coast and use it. It has transformed prostate cancer surgery into a much less invasive and actually better procedure for men.
And the mortality rate is a lot higher, I would imagine. So, as far as success rate
Yes.
is a lot better with that than what it was years ago.
The success rate is actually better. The complication rate is much less.
Mm-hmm.
Patients are able to get back to their regular routine in a much shorter time period. It's usually just an overnight stay in the hospital. It's really an improvement on just about every aspect of it.
Now, is there signs that we should look for, that we can look for, that we might find that say, maybe I need to go get myself checked, or?
No, there's not really any good signs for early prostate cancer. That's why examination,
Family history.
Yes, but examination and a blood test called a PSA or prostate specific antigen are so important.
I remember that when I turned 40, the doctor said you need to start having a PSA done on a regular basis.
Yes, once a year.
Once a year. Let's talk about kidney and bladder infections,
Yes.
male and female. And it seems like, of course, you always hear more from females, I've got a kidney infection, I got a bladder infection, than you do guys. But guys get them too.
Men can get them, but what we want folks to understand is that, that's not just what we do. We are primarily surgeons of the urinary and system in men and women, and also the reproductive system in men. We are actually able to use the Da Vinci for kidney tumors, for adrenal problems, bladder problems. There's just a whole host of problems that we treat surgically with this, and that's primarily our focus is on surgical diseases.
Now, you mentioned the different surgeries. If someone's having a regular problem from time to time, and I guess their regular physician would say, you need to go see a urologist, you possibly might need some surgery.
Yes, they would refer them to us for evaluation for any type of urinary problem or urologic problem.
Okay, well, we're going to take a minute now and talk to Dr. Spencer here. We're at South Mississippi Urology in Ocean Springs. Well, Dr. David Spencer, another one of the urologists here with South Mississippi Urology. Thank you as well for being on the show.
Thanks for having us, Jim.
Tell us a little bit about yourself.
Well, I grew up here very locally in Pascagoula, just down the road, and went off to Birmingham and did my undergraduate and then graduate school there, and then finished up training in Jackson, and then came back here, and I've been here for the past 3 years or so, establishing my practice and serving the citizens of both Harrison and Jackson County.
And you're of course one of the other urologists that use the Da Vinci unit.
Yes.
Which is
yes.
I imagine it's quite an experience. We've seen it in action before, but it's
Sure.
it's something that's it's really cool. Tell us about this time of the year, summertime. It's a season for kidney stones.
It's a bad time of year for
Why?
a lot of people. Well, it has to do with the fact that, I mean, this is just the time of year. A lot of people, it's very humid, very hot. People don't drink enough fluids.
It's a dehydration.
Dehydration plays a huge role in it. And then, of course, there's some other things that do play a role in this. Sweet tea, very common here
We
on the
love our
Gulf
sweet
Coast.
tea.
So, and very salty food. So you put all these things together, a lot of kidney stones.
Wow. So I can say that I feel fortunate, knock on whatever, that I've never had a kidney stone. But
Right.
so I'm one of the lucky ones. What about treatment options on that?
Well, treatment options, I mean, they vary from probably the most conservative is that, there are a fair number, depending on the size of the stone, that will actually be able to pass the stone on their own. Now, sometimes that takes a while and patients can be in a lot of pain. So
Yeah.
the most minimally invasive way that we have to treat stones is with lithotripsy, using shock waves. And so there's a special machine that we use, and patients do very well with that. We also do ureteroscopy, which is using a very small instrument to drive into the urinary tube and actually extract the stone from that area. Sometimes we have to use a laser to break the stone up into smaller pieces. We use a holmium laser. And then probably the last one and the most invasive one would be, it's a percutaneous nephrolithotomy, which sounds like a mouthful, but basically what that is we utilize the services of some of the radiologists to help with access through the back and actually go in with a larger caliber scope, and we remove stones that way.
Well, if someone has a problem, they've gone to their doctor or whatever, let's talk about referrals.
Referrals. I mean, referrals are really important to us because a lot of the forefront and the beginning work up is done by your primary care physician. And it's important that when patients come over and they're referred, for us to have all of their labs and all of their previous workup that's done. That way we don't have to repeat tests, don't have to repeat unneeded imaging, and we can save hopefully save money and time in that situation. It's also important that if you have a disc that you can bring to your appointment, we actually review all of our own films, and it's very important for us to do that so that we can make the appropriate surgical recommendations for you.
Okay, well, we'll mention quickly, about to run out of time. They do have 3 office locations: Pascagoula, Ocean Springs, and Biloxi. And as far as second opinions, they definitely recommend those if they make you feel comfortable. Thank you so much for being here, Dr. Lyle, Dr. Spencer, for being on the show today, sharing all this great information with us with South Mississippi Urology. And again, if you're having any of the problems that they spoke of, go ahead and give them a call.